Hi, everyone, and welcome. We will begin the webinar shortly. We're just going to wait a couple more minutes to allow people some time to log in. To those of you who have just joined, we are just waiting another minute or two to allow people some time to join us. So we will begin shortly. Okay, hello everyone. We're going to get started. Thank you for attending today's session, Improving Equity and Access to Healthy Infrastructure. The Empire State Trail Health Impact Assessment, which is a webinar of the American Planning Association, New York Upstate Chapter 2020 Virtual Conference. My name is Michaela Sweeney, and my colleague Paige Barnum and I will be your hosts for this session. Before we get started, we would like to thank our session sponsor, Environmental Design and Research, also known as EDR. Without our partners, this virtual conference would not be possible. We have a couple housekeeping items that we'd like to quickly review before we get started. All attendees are automatically muted. If you have any questions throughout the session, please submit them in the Q&A box. The panelists will stop a couple times for brief questions throughout the webinar, as well as at the end of the presentation. Any AICP members watching this evening can earn 1.5 certification maintenance or CM credits for this program. AICP members must be in attendance for the duration of the entire event in order to receive credit. The CM credit number for this session is 920-5084. I'll put this in the chat so that you remember and can look it up. You can log your credit or learn more about the AICP Certification Maintenance Program at planning.org/CM. Finally, all sessions are being recorded and attendees will receive an email link to the recordings once they have been posted. I would now like to introduce our presenters for this evening. Tonight we have with us Kyle Hatch, Benjamin Welk, Andy Beers, and Kisha Mccullough. Welcome and thank you all for being here with us tonight. Kyle Hatch is a planner at Environmental Design and Research and is the former interim executive director at the New York Bicycling Coalition. He completed his master's in regional planning at the University of Albany with a focus on planning and community health. Benjamin Welk is the health and community infrastructure analyst at Common Ground Health and is currently overseeing the Empire State Trail Health Impact Assessment. He is a steering committee member with the Society of Practitioners of Health Impact Assessments and was previously vice president of the Western Erie Canal Alliance. Andy Beers is the director of the Empire State Trail and is an employee of the Hudson River Valley Greenway. He previously served as executive deputy commissioner for the New York State Office of Parks, Recreation, and Historic Preservation, which operates 215 state parks, historic sites, and greenway trails. Andy also worked at the New York office of the Nature Conservancy for 17 years. And finally, we have Kisha Mccullough, who is a lifelong resident of Rochester and is a Shiro of the Rochester chapter of Black Girls Do Bike, which she helped create in 2016. This local group is part of an international initiative to create a comfortable space for new and seasoned female cyclists. Kisha is a licensed master social worker and is a New York State credentialed substance abuse counselor. So now without further ado, I will turn the mic over to Kyle Hatch. Enjoy.
Thank you, Michaela. Just want to make sure, there we go, I'm all set. So thanks, Michaela. Which Michaela mentioned, my name is Kyle Hatch. I recently finished my master's in regional planning from the University at Albany with a focus on community health. And just this May, I defended my master's thesis, which was focused on the use of health impact assessments in planning. So I'm really excited to be sharing the stage, so to speak, with three great panelists who are involved in a health impact assessment currently being conducted in New York State. So without further ado, let's start getting into the presentation here. The first thing I want to do is just make sure everyone's on the same page about what we're going to cover throughout this session. And like Michaela mentioned, I want to point out that we do have several instances for audience questions to be submitted. So don't hesitate to write a question in the chat, hit that send button as soon as something comes to mind. We'll do our best to get through it in these first two Q&A sessions, which will be a little bit shorter. If we can't get to your question, then we'll definitely make time to get back to it at the end of the session. So to start things off, we'll basically provide some baseline information so that all of us have a good foundation of knowledge to have a good conversation about health impact assessments and their use in planning for community health. From there, we'll turn things over to the three panelists who will basically be walking you through their role on the Empire State Trail Health Impact Assessment, as well as a project update for where things are. We'll break again for audience questions there, and then switch over to a panelist facilitated Q&A period, or more of a roundtable discussion between us here, and then finally close things out with another audience question and answer period. So the first thing, which I think is probably necessary before we really get into a conversation about health impact assessments and planning for health, is to establish a common definition of health for us all to work from. And so the internationally recognized standard definition for health is the World Health Organization definition. And that definition of health is that it's a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. I think this is important because we need to recognize that when we talk about planning for health, we aren't just talking about whether projects are going to improve or harm community health in a physical sense. We also need to think about the mental and social well-being of these communities. I'd also like to establish a little bit of a historical background of the relationship between the two fields of planning and health. Those of you that have taken planning classes or studied for the AICP exam may be having some flashbacks here, but it's okay, we'll get through the whole thing together. So we'll go ahead and get started. Some of the earliest versions of what we would consider modern planning stem from the New York City tenement housing laws, the most commonly known of which was in 1901, but there were a series of tenement housing laws enacted throughout the early 1900s. And essentially these laws were created in response to rapid industrialization during the Industrial Revolution. And they created some of these standards, that we think of as modern planning, in the sense that they set standards for housing conditions, land use, by ensuring that residents and residential communities had access to municipal parks, as well as sanitary conditions through things like regulating infrastructure like sewage, water supply, and waste. These tenement housing laws were really successful in curbing some of the public health issues that arose from rapid industrialization, so much so to the point that the federal government began issuing guidelines on how communities could begin enacting zoning standards and things to separate land use and some of these requirements that you found in the tenement housing laws. Those standards were formally challenged at the Supreme Court level in Euclid v. Ambler of 1926. And again, for those of you that have taken those planning history classes or studied for the AICP exam, they'll have flashbacks and probably remember that this is largely considered the case that established the legality of modern planning by deciding that local municipalities were working within their constitutional authority of police power by requiring these things. But what I think is really important from that ruling is when you read through it, the zoning requirements and comprehensive zoning requirements that the Supreme Court ruled constitutional said they were only legally allowed as long as those requirements had substantial relation to public health, safety, morals, or general welfare. And I definitely think it's worth noting that the first thing called out in that ruling was the substantial relation to public health. That relationship, historical relationship between planning and health, is widely recognized, so much so that the American Planning Association initiated an initiative that they called Plan for Health. Shortly after 2010 and 2016, they released a publication that recognized these roots and said that the origins of planning are rooted in the need to limit the spread of disease and increase sanitation. So since then, the fields have kind of diverged. Public health will typically handle public health matters, and throughout the course of the 1900s, planning began to focus more so on just land use regulations, economic development, transportation, these types of things that we commonly think of as planning fields. But lately, there's been a resurgence in interest in planning for health, and we'll get into a little bit why. And I'm sure some of you have heard the phrase before that your zip code is a better predictor of your health than your genetic code. Well, that phrase largely stems from this concept here, which is known as social determinants of health. And social determinants of health are defined as the conditions in which people are born, grow, live, work, and age. And all of these conditions can have significant influences on public health. They're traditionally broken down into two different factors. There are proximal social determinants of health, which have direct impact on health outcomes, and distal social determinants of health, which influence those proximal factors through intermediary factors. So an example of this would be someone's exposure to air pollution would be a proximal factor that impacts their likelihood of developing a pulmonary disease. And there could be distal factors that influence that, like if their home is located near a highway, that highway is going to influence the amount of air pollutants that they're breathing, and therefore influence the proximal factor. And so we have this pie chart here that kind of shows, it's a breakdown of social determinants of health through some main categories, and this shows health outcomes as a result of these different categories. And what I want to point out here is that when you look at what we largely consider some traditional health factors like genetic predisposition or healthcare, those factors account for about 40% of health outcomes, while things like environmental exposure, social circumstance, and behavioral patterns combine for 60%. And the field of planning has a unique ability to influence some of those factors. And the public health field has widely recognized that it itself cannot fix some of these outside factors like social circumstances, environmental exposure, and behavioral patterns. And so they need to work towards what's commonly known as a health in all policies approach. And so the United States has actually adopted a health in all policies approach from the Health and Human Services Public Health 3.0 document. And New York State has also initiated a health in all policies approach, is what they call it, which started in 2017. And basically what this is a collaborative approach to public health that integrates and articulates health considerations into policymaking across all sectors and at all levels. And so one of the things I really want to point out here is in this graphic that you see on the right, which is taken directly from the website for New York State's Health Across All Policies initiative. If you look at some of those subcategories that are brought up, the field of planning directly touches on 7 of the 9 categories there. And I believe you could probably make some arguments that the health sector and education sectors can also be influenced by planning initiatives. But the point I want to drive home is that planning has a really unique ability to influence some of these outside factors that ultimately impact the health of people living in communities all across New York State. And to illustrate that a little bit further, the public health communities created this graphic that I have up here on the screen, which is known as the Health Impact Pyramid. And if you look at public health documents published all over the place, you'll see different iterations of this graphic. Essentially what it's pointing out is, I know this is outdated, but you can think of it almost like a food pyramid. The things that you want to focus on to improve community health in a widespread manner are generally located at the bottom of the triangle. Those are the things that have a larger impact on the overall population with minimal individual effort needed. And therefore, when you're looking to solve problems that cause poor health outcomes, and you're looking upstream to solve those problems, these tiers are generally the tiers that you want to focus on. And so again, the 2 bottom tiers of this triangle are changing the context to make individuals' default decisions healthy and socioeconomic factors. So 2 fields that the planning, or 2 areas that the planning field can have a very significant influence over. So much so that, again, in this Plan for Health initiative that the American Planning Association worked on, they broke this down into 5 domains in which planners can influence health that fit into these categories. And those are active living, healthy food systems, environmental exposure, emergency preparedness, and social cohesion. And so the important thing to think about with all this is, now that we understand what social determinants of health are, the need to involve health considerations and policies across all different sectors and at all levels of decision making, as planners, we need to think about, well, how do we begin to measure health in our communities and look for metrics and indicators and things that we can work towards improving that we know will have positive health outcomes for the residents that we're planning for. And ultimately that brings us to the tool of health impact assessments. And with that, I'm going to pass things over to Benjamin Welk, who is going to walk you through what health impact assessments are and kind of give you the 101 on the topic.
Thank you, Kyle. Thank you for the excellent introduction into the social determinants of health. So we're going to talk more about the technical aspect of health impact assessments. And I'm excited to be on this panel with 2 of our steering committee members tonight, who you'll hear from shortly after I walk us through this. Next slide, please. So I find this pathway very fascinating. This is a health and equity pathway that builds on some of the language that Kyle was sharing about how the social determinants of health ultimately move towards disease and injury outcome and mortality outcome. And what I really want to present off of this slide is that there's a combination of both social and structural inequities that, when paired with living conditions and risk behaviors, are impacting the health that we're talking about. Specifically, you'll see things like class, race, gender, sexual orientation as part of the social inequities, and a range of structural inequities that come from everything from policy decisions like laws and regulations to more institutional organizations like governments and schools that all have an impact on this. And ultimately, who's responsible for addressing social determinants of health? This is a really key point, are some of the structural inequity groups that you see. So when we're trying to actually improve social determinants of health, we're working with government and local municipalities, community-based organizations, health systems, insurers, as well as the business community. And by no coincidence, that's also part of the intrinsic nature of the steering committee that we have together is representatives from all of those different sectors. Next slide. So really just a fundamental definition of health impact assessment. I really like the way that this one is structured. It kind of breaks it up into 3 core decisions. One of the most important things to recognize is that it uses scientific data. And really when we're conducting a health impact assessment, we're really trying to combine both quantitative and qualitative outcomes that not only affect health outcome data, but also look at things like demographic and socioeconomic standards to help us study a population or a community. Really the core element here, the middle step is what I call the product of a health impact assessment, which is its goal to produce not only practical, but innovative recommendations. And those innovative recommendations come from the ability to convene a multidisciplinary steering committee and have people that are sitting at a table that have never sat at a table before to try to overcome whatever the health issues are. And ultimately, the goal of the HIA is then to provide those practical recommendations to give decision makers the information they need to help improve community health and build safe and thriving communities. Next slide. So really the national standard when it comes to reporting on the practice of health impact assessments, as well as tracking how many health impact assessments have been done throughout the nation, is the Health Impact Project, which is a collaboration of the Pew Charitable Trust and the Robert Wood Johnson Foundation. We'll look at a map here. Next slide. So some of the newer numbers that we have as of 2018 indicate that over 422 health impact assessments have been conducted across the nation. But you'll see that there's quite a bit of disparity between the leaders in that category, like the state of California with 84 health impact assessments, and our own state, New York, which shows 4 health impact assessments as of 2018. We at Common Ground Health are currently working on our 4th, but outside of that, we know of only 1 or 2 other HIAs that have been conducted in the state of New York at this time. Next slide. So something fascinating about the breakdown of those 422 HIAs as shared is how they impact different sectors. And so the vast majority, 70%, are focused on built environment, which we're talking about today, obviously, with the Empire State Trail, transportation and natural resource decisions. And the minority of HIAs are focused on things like housing, climate change, criminal justice, economic policy, and other sectors. Next slide. Another fascinating way to look at how HIAs are conducted has to do with where the level of decision is being assessed, what the HIAs are addressing. And the vast majority deal with local decision-making, followed by 28% of them at the federal, regional, and county levels, and then 18% are conducted on a statewide basis. Next slide. And so this in front of you is what I commonly refer to as the HIA wheel. It's the global standard of the 6 steps that are recognized as part of a health impact assessment process, beginning with number 1, screening, where really you're looking at the feasibility of whether or not you can conduct a health impact assessment on a given project or policy or program. Scoping, where you help really refine the target populations that you'll be studying, exactly what you'll be studying as part of the HIA. Moving into the assessment, both quantitative, qualitative outcomes, the core product, as mentioned, coming up with recommendations to mitigate those negative health impacts, and then finally moving into both the reporting and monitoring and evaluation stage of the HIA. Next slide. So in front of you is a list of resources so that you can learn more about, including the organization that I sit on the committee for, the Society of Practitioners of Health Impact Assessment, or SOPHIA, the excellent resource for the technical guidance of how to write health impact assessments. And the last link is a Common Ground Health link, which will link you to the 3 HIAs that we've previously published. Next slide. And so really before turning it over to the other panel members on this presentation, it's really important for me to point out how much our former HIAs have really led to our ability to conduct the Empire State Trail Health Impact Assessment. Before you, you can see two examples of built environment and transportation projects from the 90-mile rail to trail, which is the Genesee Valley Greenway, which runs south of Rochester towards the Pennsylvania border, and the Rochester Bike Share Health Impact Assessment, which assessed the first year of then Zagster and Pace's launch of their bike share program. And I had the fortune 2 years ago of actually presenting alongside Andy Beers and the Empire State Trail, and a lot of our conversation built upon the work of the Genesee Valley Greenway and how the recommendations for that trail could possibly be translatable to the Empire State Trail, and also exploring the feasibility of conducting the health impact assessment, which we now find ourselves in the middle of. And so with that, I will turn it over to our other panel members.
Great. So at this point, we have hit our first break for any audience Q&A. So APA moderators, if you can let us know if any questions have come through on some of the topics that we've already touched on, we can address those now. Otherwise, we'll move on towards the next section.
Hi, Kyle. Yeah, we have our first question is, and this may have been captured in the steps of the HIA graphic, but it might be worth, audio commentary. But the first question is, for planners that want to conduct a health impact assessment, when is the best time to initiate the process?
Traditionally, the guidance indicates that you want to effect a process as early on as possible. We feel fortunate with the examples given. At least two of those were very early on in the process. So the Rochester Bike Share had only had a single season of being enacted before we went and actually started looking at the possible health benefits of the program. In the case of the Empire State Trail, we have the fortune of conducting this health impact assessment before the Empire State Trail is formally opening in 2021, and Andy will share more about their timeline and where the project stands currently. But I highly recommend as early as possible in the project. Alternatively, I will mention quickly, however, that in the case of the Genesee Valley Greenway, that was really an opportunity to reanimate an asset that had been around for nearly 20 years and had a relatively stagnant budget with the state, and we really kind of turned around the process to look at what the potential health outcomes could be, which led to additional funding from New York State and the Ralph C. Wilson Foundation of $4.5 million for trail resurfacing conditions. And so there are unique opportunities sometimes where you can take an asset or something that's in your community and activate it through looking at it through the perspective of health across all policies.
Hey, Ben and Kyle, this is Andy. Let me just kind of ask a related question, which is, in your experience, have you seen HIAs that have really been led by planners and planning organizations, or has it traditionally been necessary to have a partner, that a planning entity or a group of planners would need a public health partner who has the experience and the background to either lead or co-lead a process like this?
Yeah, actually, I'd like to touch on that one because that was a major portion of what my research into health impact assessments focused on. And traditionally, if you look at the data, the vast majority of health impact assessments are initiated by an academic institution, a nonprofit organization focused on health, like where Ben is, or some sort of a hospital network that is interested in looking at these things. But if you compare that alongside the data of which health impact assessments ultimately end up being implemented or resulting in long-term collaboration, those are the health impact assessments that were initiated by a planning organization, or a planning organization has been very deeply involved in a leadership role from the get-go. So the one thing I want to do and make sure people understand, to build on Ben's points, which is that you want to initiate the process as early as possible, but it's never too late. It's really important to make sure as planners, if you're looking at any sort of plan or study that you think might have some sort of outcome on community health, is to go ahead and take the steps to initiate that process yourself. As planners, we're very well equipped to pull in diverse groups of stakeholders and work with organizations that might not typically fall within the realm of planning. And so planners are they're very primed to be in a position to initiate the process and take on a leadership role as early as possible. And in doing so, you ensure a higher likelihood of success in implementing your health impact assessment.
I'll just add in real quick on that question as well. Our regional metropolitan planning organization, the Genesee Transportation Council, was instrumental in our nonprofit Common Ground Health beginning the practice of health impact assessments. It was actually a MOU between both organizations that sought to actually produce 2 health impact assessments on transportation related projects. And so really since the beginning, we've always been very intentional about making sure that we always have planners from a municipal and transportation level that join us at the table when we're conducting these health impact assessments.
Excellent. Do we have any other questions waiting to be addressed, or?
No, go ahead.
Excellent. So at this point, I'm going to pass things over to Andy, who will go ahead and introduce you to the Empire State Trail.
Perfect. Thanks, Kyle. So my name is Andy Beers. I am the director of the Empire State Trail. Our program is housed at the Hudson River Valley Greenway. If you're not familiar with our program, the Hudson Valley Greenway, it's a New York State program that focuses on conservation, recreation, trails, and cooperative land use planning in the Hudson Valley, as the name implies, from New York City up through the mid-Hudson Valley to the Capital District and the northern extent of our geographic area, Washington and Saratoga counties. But we also were selected to house the Empire State Trail program, at least for the duration of the construction and completion of the trail, in very close partnership with New York State Parks. This is a picture of the walkway over the Hudson State Park near Poughkeepsie, in Poughkeepsie, which is part of the statewide Empire State Trail route. I think this slide is important because while the Hudson River Valley Greenway is leading and kind of orchestrating this program, it is a true government partnership that involves a number of state agencies in addition to the Greenway. The New York State Canal Corporation is very involved. New York State Department of Transportation is building trail segments. New York State Parks is building trail segments. Metro North Railroad, and several smaller projects by the New York State Thruway Authority and the New York State Bridge Authority. And then in addition, we have about 15 municipal projects that are under construction by counties, villages, towns, and cities, some of which are funded from New York State grants and some of which they're initiating with their own funding. But it is, so the Greenway, we are building one major rail trail section, which is in Rensselaer and Columbia counties, but a lot of what we're doing is coordinating, facilitating what is truly a partnership effort. The Empire State Trail was initiated in January of 2017 when Governor Andrew Cuomo proposed the trail in his State of the State address presented to the state legislature and accompanied by his state budget, executive budget proposal. And the proposal included $200 million to fund the creation of the Empire State Trail, capital dollars, which was subsequently approved and enacted by the New York State Senate and Assembly in April of 2017 as part of the adopted state budget. That $200 million represents the single largest investment in trails, state level investment in trails anywhere in the nation. So January 2017 feels like a very long time ago, but we were in the right place in the right time. The state's economic situation was very sound, and Governor Cuomo, it allowed the governor to initiate this major investment in trails in New York State. Here's a map of the Empire State Trail. It has 3 legs. The first is the Hudson Valley leg, which starts in New York City at the southern tip of Manhattan at the Battery and runs up the western side of Manhattan through the Hudson Valley to the Capital District in Albany. The second leg of the trail is the Erie Canalway Trail, which starts in Buffalo and runs 350 miles across the state, west to east to Albany, the Capital District as well. And the third leg runs north through the Champlain Valley. The first 60 miles north of Albany is called the Champlain Canalway Trail. It follows the Champlain Canal. And then north of Whitehall, it runs on public roads. It's a bicycle route through the Champlain Valley. The color graphic on the scheme, anything that is green when the trail is complete later at the end of this year, will be off-road trails. These are either rail trails or canalway trails or similar shared use paths. They are typically 10 feet wide, and they have either a paved, asphalt paved or stone dust surface, so they're suitable for bicycles and walkers, runners, people pushing strollers. All the surfaces are ADA compliant. They have relatively, they're level, wide and flat, so they are accessible to bicycles and pedestrians of all ages and abilities. The green sections that start in New York City, run to Albany and Buffalo, are the primary off-road sections, rail trails and canalway trails. That's 550 miles. And when all our projects are complete, 85% of that distance will be off-road trails where people will be, non-motorized recreation. The yellow sections are connecting sections where, at this time at least, there's not an opportunity to create. There's no abandoned rail trail or canalway corridor we can use. That doesn't mean at the end of 2020 we're done. There certainly will be further efforts by New York State and our partners and local governments to continue to build additional off-road trail to whittle down those gaps. As I said, the program is funded by a $200 million state appropriation. And in addition, there's been almost $90 million of leverage matching state, federal, local, and private dollars that are funding these projects. The Empire State Trail is a co-branding exercise. The trail is stitching and knitting together a series of regional trails. The Erie Canalway Trail is by far the longest at 350 miles, which is part of where our project area is. But in, say, the Hudson Valley, there's 13 miles of the Dutchess Rail Trail and 5 miles of the Corning Preserve Trail and 13 miles of the Wallkill Valley Rail Trail and the 1 mile Kingston Point Rail Trail in Kingston. So a lot of this network already existed. There were about 400 miles of the 750 miles existed as existing trails. What our initiative is doing is stitching together and building out the gaps, off-road trails wherever possible, and improving shoulders and signage and safety measures and sidewalks and other things on those sections that will remain on road to create this continuous network that is branded as statewide as the Empire State Trail, but also each of the local trails, whether it be the Erie Canalway Trail or the Dutchess Rail Trail, for example, so forth, will retain their own local name and their own local character as well. The goals of the project, here are 6 goals. I'm not going to go through them in detail, but outdoor recreation is obviously one of the primary goals. Community vitality and community development. Their trails come out as a very high amenity that young people want, that older people want, retired people want. They are an important, they're not a silver bullet for economic development, but they're part of a coherent economic development strategy at the local and regional level, and particularly in our upstate communities and cities. And the Empire State Trail essentially follows the Thruway corridor and passes through many of our upstate cities and villages. Tourism-related economic development, particularly bicycle tourism, whether people are coming to the trail for a multi-day trip or whether they're doing it along with other things and get that extra day stay. And then public health is a key point, and that, obviously that's the point of tonight's presentation. Safety and then civic engagement of getting people involved and excited in their communities. On the public health front, I would add is that, I'm a parks and trails person professionally my entire career, and so we certainly say public health is one of the benefits of trails, the Empire State Trails and trails in general. It's intuitive. It's both physical health and mental well-being. But frankly, those of us in the trail communities, we're all got our heads down working on our trails, and we have not really engaged much in the public health arena. And frankly, my ability to explain the public and quantify the public health benefits of the trail are very thin. There wasn't much below just saying it. And so this has been a very exciting project for myself and my colleagues at State Parks to really learn more about the details and thinking about both two important questions. One is how can we better quantify the public health benefits of trails? But secondly, we know that all across the state, as we collect user information on these rail trails and these canalway trails, The population that is using them is, on balance, it is older, more affluent, and whiter than New York State's population as a whole. And in many cases of the population, the nearby residential, the makeup of nearby residential communities. And so part of what we're very much looking for as the endpoint of this health assessment is what are the, you know, we all have ideas, anecdotal ideas why we think, you know, our trail use is not as diverse as we would like, but to actually, you know, through this process, really tease those apart and come up with some proactive strategies that would help bring new trail users to the trail. This is the trail running through the 3-study county area in Wayne, Monroe, and Orleans counties. It is primarily complete. It's about 90 miles in length. There are some also connecting north-south trails, most prominently the Genesee Valley Greenway Trail. It is mostly an off-road trail, although you can see in the eastern part of the trail, the blue, there are some on-road sections. Half of the trail really is a construction project, 60 construction projects, large and small, that we're completing across the state. Half of those are done, and the remainder are on schedule to be completed by December. So despite the challenges of the pandemic year here, we're very gratified that New York State and our local partners are on track to complete the trail, and it will be a continuous 750-mile route for use, you know, starting in January and probably more significantly in the springtime when people really get out and start walking and bicycling. Last slide I have is we have an Empire State Trail website. If you were to, you can just use Google or your search engine, Empire State Trail, it will come up. This is a fairly static website, but for planners, I will call to your attention. We have one of the documents you can download and access from the website. It's called the Empire State Trail Design Guide. It is a lengthy, sorry about all the phones going on. It is a lengthy, guide. Parts of it are more about just the signage and look of the Empire State Trail, but it has detailed sections that capture the state of the art about trail construction, on-road, bicycle and pedestrian facilities, and crossings, safe crossings. And so if you want to know, when do I use a rectangularly rapid flashing beacon and when don't I? What's the difference between a cycle track or a side path along the road? All that information is there. It's written in it's intended for professionals in the design, but it's not engineering. It's elected officials and others could all read that and understand it. Last thing I'll say, and then I'll turn back to Mike, is that we are going to soon, in the coming weeks, be launching a major upgrade to the New York State, to the EST website, and among other things, that will include an interactive mapping feature, which will allow users to zoom in and see the precise details of the 750-mile route in their community. It shows which sections are asphalt, which sections are stone dust, which sections are on road. It shows all the designated parking areas and addresses for those along the trail, all campgrounds within 10 miles, and then a number of attractions like historic sites, local parks, and cultural facilities, museums, and other things along the trail. So that resource will be a public-facing resource to really promote and provide detailed information to trail users as we complete the trail and heading into 2021. So again, in closing, we're sprinting. We got 3 months left. We're going to get there, and it's really been gratifying to see the collaborative effort, true collaborative effort between state and local government across the state to achieve this. Thanks. I need to turn that back.
Yep, I think we have it all set.
Awesome. Okay.
Thanks so much, Andy, for the update. All right, next up, we're going to turn things over to Kisha, who's going to walk you through her organization and some of her background with being a steering committee member on the trail. Kisha, take it away.
Hi, I'm Kisha Mccullough. I'm the founder of Black Girls Who Bike Rochester. So I wanted to share a little bit about my journey as an adult cyclist. I purchased a bike when I was 50 years old. That was a few years back. And for 2 years, my bike riding was primarily done on the Canal path. And I noticed that I didn't see any women of color out riding, and I didn't see any women or any women in my community riding bikes. So I basically started searching for women of color on bicycles and came across Black Girls Do Bike, reached out to, oh, next slide, sorry. Reached out to Monica Garrison, pictured right there, who is the founder of the National Black Girls Do Bike organization, and just started inquiring about the group. And she was telling me that, you know, they have 85 chapters, or I think at the time it might have been 70 chapters. And I said, well, do you have a chapter in Rochester? And she said, no. I said, well, can I start a chapter? And she said, yes. And that night, Black Girls Do Bike Rochester was born. So that was almost 5 years ago. So Black Girls Do Bike as a national organization is a space for women cyclists. We encourage all women to ride, but our focus is on Black and Brown women. So we're a very inclusive, accepting group. We encourage, you can go to the next slide. We encourage positive fellowship, fun, safe cycling. We're always looking for ways to bring new cyclists in, so paying it forward. So as the screen reads, our vision is to create and establish a comfortable place where seasoned and new female cyclists can support one another in organized rides and skill sharing. So we have some people that are, you know, beginner riders, intermediate riders, and more advanced riders. And we work together, we help each other, we push each other. Just recently, my bicycle group, we did a 30-mile bike ride, but it was not just a flat 30 miles. It was hills upon hills upon hills upon hills upon hills. It was treacherous, but we made it. It was about 6 of us, and we did it. So we support each other and challenging ourselves. So these are some of the core values that I mentioned earlier: inclusivity, safety, positive fellowship, and just paying it forward. Pictured there is some of the ladies from our Atlanta group. Right now we have 85 plus chapters that's part of the organization. So we're steady growing and growing and growing. Next slide. That's me right there, and some of the ladies from Black Girls Do Bike Rochester. So as I stated, the Rochester chapter was born July 17th, 2016. And we basically subscribe to the core values and mission and vision of the national organization. We highlight and support representation in all aspects of cycling. For example, we have one lady who did a solo ride across country for stroke awareness. So we kind of supported her financially, prayers, positive vibes, and a myriad of other ways. Another lady has her sights on being the first professional Black female racer. So we're rallying and supporting her as well. So one of the things Black Girls Do Bike Rochester prides itself on is reaching across the lanes. And that's collaborative community cycling. So I'm very pro inclusive, being inclusive, riding with other groups, riding with people that don't look like me, people of different abilities. So you can find the Black Girls Do Bike Rochester chapter coordinating bike rides that highlight people being killed on bikes by motor vehicles in the Ride of Silence, coordinating bike rides around recovery. We've done that a couple of years. We do a lot of themed bike rides, which are typically co-ed. We also do all women bike rides. I think last week we did a Black Lives Matter bike ride. We did a Black Lives Matter bike ride that was an all women's bike ride. Next slide. So really quick, as it was forestated, I am a mental health therapist and wanted to just share that bike riding is very, very good for improving one's mental wellness. Bicycle riding can help reduce depression, anxiety. Just the mere fact of riding with a group promotes fellowship and that social element. And because we're interconnected, you know, we all want to belong, we all want to have friends. So that promotes feeling good about yourself and a sense of connectedness. Next slide. Everything else? Okay. So I wanted to just highlight a few reasons why I decided to get on the Empire Trail Health Impact Assessment. My first thought was, nope, don't want to do it for various reasons. But then I trusted the Common Ground CEO, and the altruistic part of me was compelled to say yes, because I think it's important for women, especially women of color, to have easy access to bike paths and trails, to feel safe, to feel comfortable and confident on bicycles. Next slide. So these are some of the links to the Black Girls Do Bike National Organization, as well as the Black Girls Do Bike Rochester chapter. Most of the chapters are all female spaces on the Facebook, but as I said before, some of the rides are co-ed and some of the rides are all female. Next. Thank you.
Thanks so much, Kisha. Appreciate it. For here, we're going to pass things over to Ben Wilk, who's going to give us an update on the Empire State Trail Health Impact Assessment, kind of bring us up to speed with where they're at and maybe some of the early findings.
Thanks, Kyle. So I'm really excited to share where we are in the process and the work we've accomplished to date. Go ahead and move to the next slide. So as you'll recall from the 6-step HIA process, the arrow here indicates that we're really reaching the end of our assessment phase. We're still gathering some qualitative data, but we're really actually beginning to solicit feedback. Last week we had a 2-hour meeting with our steering committee in 3 breakout groups ourselves to really begin to look at ways we could leverage the Empire State Trail to impact our regional target area, which I'll share a little bit more detail about now. Next slide. So a little bit more about the composition of the assessment for the HIA. And a lot of thought has gone into this. We're pretty excited about this model that we've developed that really does mix quantitative and qualitative data, focusing on things that are more traditional to planners, such as demographic and census data. We've developed a vulnerable population index within this HIA, and I'll share a little bit more about that, but what it's designed to do, it's modeled after the Center for Disease Control, who looks at it as a hazard management tool to find out which populations could be impacted the most severely based across 10 different census factors. And then it formulates a score. So we've adopted a process for that for our target area. Health outcome data, obviously, is part of an HIA, is a key aspect. Common Ground Health really leads the data in that sector using a multi-payer claims database from different insurance providers across our 9-county Finger Lakes region. In this case, the 3 counties we're focusing on for the Empire State Trail. A literature review, which is really going to focus on the barriers that Kisha discussed and Andy also alluded to about working towards greater inclusivity and diversity on the trail, working with vulnerable populations to improve their health outcomes, both from a demographic and socioeconomic standpoint, as well as those that have vulnerable health conditions. And then finally, we have a primary data collection aspect, which I'm also very excited about, which involves an Empire State Trail survey that was mailed out to 10,500 households across our target area, as well as something called a PEQI, or Pedestrian Environmental Quality Index. And I'll begin talking about those in just a moment. Next slide. So as Andy mentioned, this is the 3-county area that we're focusing on: Orleans, Monroe, and Wayne County, Rochester being right in the heart of Monroe, is the largest population center of a city just over 200,000. You can see from the map the total population density in the areas where the population is the highest, not surprisingly found in Monroe County, with various zip codes showing over 25,000 people. Just a few details about our Empire State Trail target area and why we are highlighting the zip codes we are. So we decided to focus on 23 different target zip codes across the region, and all of those zip codes directly interact with the Empire State Trail itself, which for our region is synonymous with the Erie Canal. The target area represents 834 square miles, or 29% of all 3 counties in terms of land area, and a population of 392, just over 392,000, which is actually 44% of the population are found in zip codes that are in direct proximity to the trail. And as we've discussed as well, focusing on a residential impact and residential connectivity to the trail is key. And we feel like if we can begin getting these population areas activated, we know that we can improve the health of our region. Our region also represents, very rural communities, as well as urban and suburban. And so we have a nice array of communities to focus on with this implementation across 3 counties. Next slide. So as mentioned, one of the tools we're looking at to integrate census data is the Vulnerable Population Index, modeled off of the Center for Disease Control, and also we've looked at the Baltimore Metropolitan Planning Organization's Vulnerable Population Index. We've come up with a proprietary list, in this case, of 10 different census tract figures that we're going to use for our region, and our overall baseline for comparing our data is New York State minus New York City. Next slide. So I'm just going to share a few of the variables that we're looking at. I will call out that some of the variables that we have utilized include things like looking at the percentage of the population over 65, like the map in front of you. We're looking at minority communities, the percentage of non-white across our area, those who are unemployed, those who have limited English-speaking households, median household income, as well as a few other that I'll share here. But the map in front of you is actually showing where we have the highest percentage of those who are age 65 years and older. And you'll also note that the dots indicate where the nursing homes are in the area in the zip codes that are in direct proximity to the Empire State Trail. And so just a little additional data that's not shown on the slide here, the baseline for New York State minus New York City is an average of 16.6%. And we're seeing that our region actually has a greater concentration of aging population than that. So places like zip code 14626 in Greece, which with as high as 23%. But we also have 4 more other zip codes that are shown that are above the 20% threshold. And as you can see, actually a majority of our region is above 15%, those 65 years and older, which is one vulnerable population segment. Next slide. So building on that, we're looking at the percentage of those that are disabled. In the state, the baseline is only 12% average for those that are disabled. And once again, we're seeing that our region is elevated beyond that. We have areas like Savannah in Wayne County with as high as 21% of the population disabled. In the city of Rochester, we have over 20% as well. But this is something we want to actually dig down a little bit further and make sure that at all times we're thinking about the ability for all people of all abilities to utilize and access the Empire State Trail. Next slide. And so this is the percentage of people that are living in poverty. Again, this is one of the 10 census tract variables we're looking at for part of our vulnerable population index. What we'll do is once we look at all 10 factors, we'll come up with a score for each region, and we'll actually flag those regions that have more factors than less, a majority of factors more severe than the baseline averages. In this case, for the poverty census element, the baseline is around 14.5%. And once again, our region is off the charts. So we have zip codes like 14611 in the heart of the city of Rochester, where over 41% of people are living in poverty. And actually 2 other zip codes in the city of Rochester that come in at around 30% of those living below poverty and 23% of those living in poverty. So we want to focus on these residential communities and look at how we can utilize the Empire State Trail to benefit their health and their overall well-being. Next slide. So I mentioned as part of the composition of assessment that one of the key things we're doing is actually engaging in primary data collection. Actually, we're wrapping up with a team of about 12 people. We've been looking at over 135 different access points in our area and engaging in something called the Pedestrian Environmental Quality Index, which was developed by the San Francisco Department of Health in 2008. It looks at the safety of the pedestrian environment and whether it's conducive to physical activity. So we're going to look at all 135 access points in our region. And then the survey, as mentioned, so far out of the 10,500 households that were mailed, we received 973 responses to the survey to date. But we really are looking at trying to increase responses among those who are low income and people of color. And so we're actually working on trying to increase a qualitative effort due to limitations from COVID-19 and the inability to directly outreach to some of those communities today. Next slide. So a lot of this I already covered. The only thing I'll mention is that the on-road portion that was identified in the map that we're actually not conducting an evaluation of the access points as part of the PEQI for that, just out of an abundance of safety and also really an inability to grade access points based on the fact that they currently are road portions. Next slide. And so as mentioned, these are the 135 access points that we'll be looking at. You're looking at the far right on your screen in Wayne County. That is a map that Andy also showed that really once you reach Clyde, everything east of Clyde moves to on-road. Next slide. And there's an example of that map again, where we're seeing on-road portions currently in our area, and also a difference of the portions that are asphalt through our county, as well as those portions of the trail that are stone dust. Next slide. So as mentioned, where we stand now is we're going to be moving into the recommendations, reporting and monitoring and evaluation stage. And I just kind of want to share a few thoughts out loud in terms of what we're thinking at this point. So these are 3 questions that we're asking ourselves as we conclude this HIA. So how might we increase overall awareness and outreach to get vulnerable populations on the trail? How can the Empire State Trail be leveraged to engage and improve the well-being of the vulnerable populations identified? And ultimately, how might health conditions relate to future recommendations for the Empire State Trail? So really between now and the end of this calendar year, we're going to be focusing on integrating recommendations that will be part of the health impact assessment. And we're looking at an early 2021 publication date for the report. Next slide. Thank you.
So at this point, we're going to open up for another round of audience questions. I do want to point out that we're running a little bit ahead of schedule, so we have plenty of time for questions. So again, if you have questions that you're curious about, please submit them in the chat. We'll have time to get to them, and we can take another round of those right now.
All right, so first question, is there a way to measure the relationship between health impact assessments and a community's financial and economic health?
I guess I would wonder, when we're talking about a community's financial and economic health, are we speaking specifically about the municipality's ability to fund something like a health impact assessment? Or are we speaking more about the economic well-being of the residents of the community? I guess to potentially touch on both of those, as we saw in some of Ben's slides, economic health is one of the measures that is looked at in a social vulnerability index. I will say that when I went through and I did research on health impact assessments conducted nationally, that there were many concerns about a municipality or some sort of government organization's ability to fund a project like this. They are time and somewhat resource intensive, but I think this ties into a question that was asked earlier about, when do you initiate this process? And if planners were to initiate this process and include a health impact assessment along with like an inventory and analysis of a comprehensive plan, then you can fit a level of health impact assessment within the budget of those things. And ultimately, as Ben pointed out with his Genesee Valley Greenway study, these things can result in funding for specific projects. So, if a community is able to invest the money up front to pay for this type of study, there's the potential for long-term benefits down the line through outside funding sources to implement plans. I don't know if anyone else has any input on that topic.
I would just add that a lot of the times we need to look at the cost of what chronic conditions are in a region and the impact that they have on not only privatized spending, but also public spending when you look at things like Medicaid and Medicare. And so if there's an opportunity to utilize a community infrastructure asset, in this case, we're talking about what will be the longest multi-use trail in the United States with the Empire State Trail, we have an incredible opportunity to move residential populations to begin utilizing an asset like that and increasing not only their physical health, but also their mental health. And we will be reporting on mental health outcomes as part of this HI as well. So sometimes it's looking at the cost of medicine and the cost of doctor's visits and also the individual costs, the difference between utilizing a free trail like this and improving one's health and having to go to repeated doctor's visits or pay for prescription medications. If there's any possibility to help mitigate that, this is where a health impact assessment can shed some light on some of those alternatives.
Great. So another related question is, curious if you could comment on some of the factors that may have created the disparity in the numbers of health impact assessments among states, whether it might be a difference between reporting requirements among states or just priorities for communities or leaders, other factors?
It's a great question. I will say that I think that different states have a more broad culture of public health at times that integrates more with their planning. So specifically, I'll call out California as an example. I think about when we were conducting the Elmira housing health impact assessment, we were researching the fact that California had come up with health-based code enforcement. And so they could actually identify when there were concerns with homes that could lead to health impacts, such as water intrusion and mold, issues of insulation, things that could relate to a lot of respiratory distress like asthma and COPD, among other disease types. So I think it has to do a lot with just the traditional culture, that you're seeing in those states, sometimes some of the policy making that's happening with that. But it is an excellent question. Why HIs in particular are not being engaged more in certain sectors in certain states.
I can build on that a little bit too. In my research, one of the reasons California comes in so highly is there's some leading academic institutions that like to take on a lot of health impact assessments. So as mentioned before, the vast majority of these have typically been conducted by academic institutions, nonprofits, or health organizations. And so there are some colleges out on the West Coast that are really heavily engaged in conducting health impact assessments and researching them. And that's part of the reason you'll see a high number out in places like California or Oregon. I also want to point out that if you look at the East Coast, the state of Massachusetts has conducted 21 health impact assessments as of 2018, which is the highest number on the East Coast. And the reason for that is the Massachusetts Department of Transportation actually now mandates health impact assessments to be conducted alongside environmental impact assessments as part of their statewide requirement for large-scale transportation projects. And so that's driven a large number of health impact assessments in that state. I think what's interesting to note is because they've standardized the process of conducting a health impact assessment, is oftentimes in the health impact assessments coming out of a place like Massachusetts, you don't necessarily get the same level of detail and analysis that you might get in some of these places that are much more interested in conducting the assessment for the sake of actually understanding the outcomes and not necessarily just to meet basic minimum legal requirements. However, there are some places that do mandate this level of study. So California and Massachusetts would be two of those.
Great. Another question we have is, one attendee is curious about Kisha's thoughts on barriers for women cyclists. The attendee notes that they cycle a lot too, and noticed that there were few women cyclists such as themselves.
So one of the things I found with the women that I ride with, they don't feel safe. People just don't feel safe riding in the city or in the streets, especially if the infrastructure is not conducive to safe riding. So particularly women, which is who I ride with mostly, we need that element of safety. You know, we have to get home to kids, to husband, to wife, to job. So less likely to jeopardize our life to ride a bike. That's what I found with the women that I ride. They just really don't feel safe.
All right. Another question we have is, how has the COVID crisis changed the data and study?
It's a great question. Other than being work from home since March, which I'm sure many people can relate to, and having to digitally convene all of our steering committees, as well as do different webinars. I think the greatest portion of this HIA that's been impacted is our primary data collection. We had a real plan for outreach into a lot of these communities. We wanted to go to a lot of public libraries, recreation centers, work with neighborhood association groups to increase survey respondents. And unfortunately, that's been more or less an online activity at this point, trying to encourage that, which is why at this point we're trying to pivot and actually look at the potential for doing focus groups and or some type of interviews, because we feel like out of those that have responded, we have an overwhelming percentage of people on the survey that are white and affluent. And so we're really trying to make sure we're hearing the voices of those that may be experiencing barriers. So hopefully the qualitative effort between now and the end of the year will broaden that, but that's specifically how COVID has impacted us today.
Yeah, this is Andy. I was going to jump in and say, from a trail perspective, it is quite clear that in the last 6 months, we've seen a very dramatic increase, a spike in the use of these trails, bicycling, walking, runners. You know, it's intuitive why, right? People, it's outdoors, it's almost socially distanced by definition. Most trail users are in small groups, often with families or friends. And, you know, anecdotally, everyone's reporting this. We're starting to see a little bit of data, but there are trail counting systems in various places across the country. I have no doubt that starting next year, people are going to start reporting this dramatic increase. It will be fascinating to see, you know, a couple of years from now, hopefully, right, the vaccine and some of this stuff is receded behind us, and does this level of increased trail use, does it increase? Hopefully, is it sustained? Hopefully it is, and hopefully we've brought some new users that are sustained users, but it's going to be something we're going to be monitoring over the next couple of years.
Great. Another question that just came in is, what do implementation strategies look like for health impact assessment recommendations?
It's a great question. I think honestly, a lot of it starts with who you convene at your table. I think there is an absolute need to make sure that you have a broad enough coalition of people that they can take ownership over both the recommendation synthesis and ultimately implementing some of those recommendations when they go out. I think that's one of the most important elements of why we have representatives as part of this Empire State Trail HIA from all 3 counties, from a mix of public health to governmental leaders, municipal planners, transportation planners, but we also have linkages at the state, not only with Andy and the Empire State Trail, but also with New York State Canal Corporation at the table, New York State Office of Public Health at the table. Having a broad coalition of people who have the ability to be keenly paying attention to the data that's presented and the recommendations that are being created is a strategic move. Outside of that, I think determining recommendation strategies that are pragmatic, things that can be implemented. There's room in the health impact assessment process and the monitoring and evaluation section to do a little bit more kind of dreaming, if you will, outside of the practical recommendations, things that you don't feel you can put forward that may be accomplished in the immediate future, but things that people can be thinking about longer term. And so I think just an eye of, coming up with very specific targets as well, targeting, potential populations. For us looking at this social vulnerability index, we're certainly going to recommend not only geographic targeting of certain communities based on the health and demographic outcomes, but I think we're also going to look at specific population segments and how we can activate those segments to utilize the trail. I would recommend looking at the previous recommendations that we've made and things like the Genesee Valley Greenway Health Impact Assessment, which looked at things like trail resurfacing and leveling surfaces to an ADA compliant standard, and that led to direct funding. I would also look at recommendations in the housing HIAs, just for more examples before we come out and publish this one. Thanks.
I want to build on that a little bit as well, and point out that occasionally this will depend on the type of plan that a health impact assessment is being conducted on. So, in this example, we're talking about a very specific infrastructure project, but there's some really interesting implementation case studies from other types of plans that health impact assessments have been conducted on. And so one that I really like to point to is a health impact assessment that was conducted alongside the long-range transportation plan for the Nashville Metropolitan Transportation Authority, or the Nashville area MPO, Metropolitan Planning Organization. And essentially what they did is they conducted this comprehensive health impact assessment alongside this long-range transportation plan. And while they had an inkling that the transportation system in the area was having a negative impact on health impact assessment, really broadened their eyes to the scale and scope of those impacts. And so what they decided to do was to create a scoring system for all future funded projects. It was a 100-point scoring system, and out of those 100 points, 80 points were allocated to things that they had identified as healthy infrastructure components. And so the way that they had decided on those was basically they looked for indicators within the transportation system that would influence health. So things like how many people walked or biked to work or school, or the number of people that drove alone, vehicle miles traveled, things like that. And they identified metrics that would help bring those indicators closer to where they wanted it to be. And so that's how they came up with those points within the scoring system. And ultimately what this scoring system resulted in was a 3,750% increase in the number of projects that were funded with healthy transportation infrastructure components. So it was, massive increases in sidewalks built, crosswalks being installed in roadways, trail systems were developed, traffic calming measures were implemented because of this that may not have otherwise been implemented. And so like Ben pointed out, it's kind of an opportunity for you to become creative, and depending on the scale of the study or the project that you're looking at, planners have this unique ability to, I like to think of it as systemically correcting for the systemic issues that have resulted in poor health in certain communities. And so if you really take some of these implementation measures like what the Nashville area MPO did, and you think about this from a long time horizon, in systemic implementation strategies, there's really an opportunity to have a significant impact on your local communities.
Great. So it looks like that's all we have right now from questions from attendees. So I'm sure we'd all love to hear more on the sort of panelist facilitated Q&A there on the agenda.
I have a question. I'd like to ask Ben and Kyle. So this is a very labor-intensive process. It's going to give us some really good information. If you think about the maps you were showing of some of the socioeconomic data for the study area, you see Rochester, an urban area. You see an outer ring of more affluent suburbs. and then you see the trail going through more rural areas and then punctuated by smaller villages and hamlets along the route, right? I mean, the situation of this study area, kind of generically, Buffalo would look like that. Syracuse would look like that. Utica would look like that. Albany would look like that. Even some of our smaller cities like Rome or, Amsterdam, whatever, right? So my question for the two of you is, to what extent do you think the findings and recommendations out of this study are broadly applicable to these other communities, particularly along the Erie Canalway Trail section between Albany and Buffalo, where we are upstate cities and villages and towns? Where do you think it's safe to take a lot of those findings and recommendations and just try to apply them elsewhere, or is that a mistake and it would necessary to do at least some ground truthing of the findings, if not a full HIA, in Syracuse and in Utica, in Albany, in Buffalo? What are your thoughts about the applicability of these recommendations?
So I think that by intention, what we've really tried to do is come up with some uniform standardized assessment practices that could be prototyped through this HIA and applied to other communities. And so specifically things like the Vulnerable Population Index, each one of those communities in the region or other communities along the Empire State Trail could take that exact same tool, utilize the exact same 10 census factors that we've combined, and then conduct it on their area. I think the goal with the Pedestrian Environmental Quality Index as well, and coming up with a standardized process for evaluating access points, that's also a great example that could become localized if different regions of the state go and look at that. And then I think even from the health outcomes standpoint, we didn't present a lot on the health outcome data tonight due to time limitations, but we've really tried to look at chronic disease conditions and mental health conditions that can specifically be impacted by a lack of leisure time, recreation, and physical activity. And so those are not going to change in different communities. You could look at the same exact chronic disease outcomes, but look at what the prevalence of those are in those regions. And so I would say, while our findings for this health impact assessment are for our 3-county target area, which we do hope looks a lot like other areas, it was definitely chosen by intention to have a combination of urban, suburban, and rural communities. I think the goal in these communities would be for them to take a slightly deeper dive, utilizing some of the tools that we'll present in this HIA. And the recommendations may also be very standardized. I think when it comes to things like outreach ideas or programmatic ideas to engage vulnerable communities, or if it's about enhancing access points in a certain manner, I think that there will be recommendations that could be very uniform in their application across New York State.
I don't have anything further to add to that. Thanks, Ben. That was a very comprehensive answer. I want to direct a question to Kisha. Before I get into the question, I want to make sure that we all extend Kisha's sister a happy birthday. It is Kisha's sister's birthday right now, and so after this, she's heading over to the birthday party. So my question is, in the question you were responding to earlier, you mentioned that the main component, or the reason why you feel you don't often see women riders out is because of safety. And I will say, as someone that led a statewide bicycle advocacy organization for a while, the typical bike advocate tends to look like people like myself, Ben and Andy. And so, I'm wondering, to get your perspective as, the head of an organization that's aimed at building a more diverse and inclusive bicycling community. Do you think if we're able to build up a more diverse and inclusive bicycle community, that will ultimately impact the way that bicycle infrastructure gets built? I guess I'm just curious to hear what you think, those missing voices, that the role of those missing voices is in the way infrastructure ultimately gets built. And then to follow up on that, if you feel like this health-based approach might be a way to overcome some of those traditional barriers for bike advocates coming out and speaking, having a more diverse bike movement come out. Oh, you're on.
Unmute. Thank you. Yes, so I currently am a member of 2 bike advocacy groups here in Rochester, and no surprise, I'm the only African American at the table. There are other women But what I found with those groups is that their focus is not the inner city. Some areas of the city, but not the areas that are heavily populated by Black and brown people. So, you know, if we had a more diverse bike advocacy groups, I'm thinking that would encourage more bike infrastructure in areas where Black and brown people live. So I live in the inner city of Rochester. I always have, and you know, I love where I live. I love the people, and but it's scary sometimes riding my bike from home to the trail or home to my granddaughter's house. But I've grown as a cyclist. So, you know, I'm a halfway LCI. So I know the rules of the road. But for the average, and I'm just really speaking for women and particularly Black and brown women, most of them that I come in contact with are not risk adverse, you know. So, you know, I think if we had more people that look like me, you know, advocating for bike infrastructure, maybe, you know, we would have more bike lanes, we would have, you know, the things that we need to make cycling safer in our communities. And please restate the second half of your question.
Yeah, I just was wondering if you could, I guess, speak on some of your initial impressions on whether you think, I guess, approaching trail infrastructure from a health perspective ultimately helps to widen that group that people speak to when they're talking about building a trail, and if you think it can be an effective method for you know, getting more representation as far as you know, people speaking out on what type of infrastructure they want in their community goes.
So in my line of work, the number 1 and 2 goals primarily are, I want to be happy and I want to be healthy. So I feel like if people were made aware of the benefits of using the trail, they would use it more. If they, you know, if it was easier access to using it, they would use it more. When you inform people of how doing something could benefit them, they're more likely to do it, more likely. So I think the health impact assessment is a good method to begin to encourage people to use the trail more. Again, demonstrating through various means how it would benefit them, how it would benefit their health, how it would benefit their happiness. When you have happy and healthy individuals, you have happy and healthy families, you have happy and healthy communities. So.
Thank you so much. The next question I have, I want to direct to Andy, and this is circling around, well, we have about 5 minutes left, so I'm hoping to get through 2 more of these before the end of the session. This first one's for Andy, and I want to circle back to a little bit of what we were talking about with implementation strategies before. And I guess what I'm curious about is, you know, being a part of the Hudson River Valley Greenway and conducting this health impact assessment. You know, the Hudson River Valley Greenway is conducting the health impact assessment, but ultimately, as you mentioned, they're primarily only responsible for the entire Empire State Trail until the completion of construction of the trail. So, and maybe this is a question for Ben as well. I guess, how do you foresee the implementation of some of these recommendations taking place? Like, are there other local trail organizations that are going to have to take the lead on that? Do you believe there's still a role for the Hudson River Valley Greenway to take some of this stuff on? And how do you foresee that implementation path being enacted?
Yeah, that's probably a question we could spend a half hour discussing, so I won't do that. But I guess a couple things. I mean, the Greenway was, for a variety of reasons, we're overseeing the creation of the trail. We're going to be passing the baton to New York State Parks, which is a much larger agency and better situated for the long-term promotion and extending the trail. So that will happen. You know, I think there's an opportunity at the state level, and this is where I live and breathe, right? For 3 state agencies to collaborate much more closely than they have in the past, and that's Parks and the Greenway being basically part of Parks. Our Department of Transportation, which, you know, makes decisions both directly on state infrastructure, but also through the municipal planning organization processes of how counties and towns invest their transportation funds that come down from the state. And our Department of Health, which is thinking about these issues in holistic strategies. And, you know, I want to be hopeful that together there'll be some relationships forged here that will survive this and perhaps allow these 3 state agencies to work with our city and our county leaders and Ben's organization and Kisha's and others to really follow through on some of these recommendations to actually make some things happen on the ground and learn more. So I am optimistic that that will happen. I mean, obviously the state and county and municipal finances are all headed towards a cliff right now. And so that is going to impact perhaps the speed at which some of these, you know, recommendations can be implemented. But I do think there's an opportunity here to build on this and build something more that's more continuous and lives on beyond the completion of the study. That's certainly the goal.
Excellent. And then I do want to get one more question in. This one is for Ben specifically. So Ben, I know you've conducted, at this point, I think you're the most prolific publisher of health impact assessments in New York State. And so it's, I guess I'm just,
when there's so few. Fun. Yeah.
you know, I'm really curious about, it sounds like you've interacted with planners quite a bit when you've conducted these health impact assessments. And so coming from the community health side, do you typically find that planners are thinking about community health as they're working through their projects? And, you know, have you, I guess, any specific moments come to mind where you've seen planners maybe have an aha moment or something along those lines?
That's a great question. I would say from personal experience, it's a rarity. I think a lot of the times, you know, when we approach these projects, we're trying to advance health-informed decision-making. And very fortunate that nearly 5 years ago now, the Genesee Transportation Council and Common Ground Health both looked to join up for that potential, you know, and so there was direct transportation planning relevance to the work that I was doing. You know, and organically for me, I can tell you that as I've brought in the practitioner of health impact assessments, my interest in planning has also grown. So I'm actually in the process of trying to pass the AICP exam myself. So I'll look back at your slides for notes later to help me study for that. But I continue to see a great opportunity really through the governor's Health Across All Policies initiative. And I highly encourage people to look at that more closely. The fact that the governor has mandated that every department in New York should be considering health advancement and health equity is a really important thing. And I also think even for strategically for recommendations and other things to possibly be financed, you know, if you are going through the state for grant applications, including metrics of health makes a lot of sense at this point. So I would say that in the traditional planning field, from a government aspect, from a private planning practice, I think there's enormous room for growth. But I think if 2020 has taught us anything, it's that health can impact literally everything. So the time is now to go and do these things.
Awesome, thanks. And I know we're getting close to the time limit, so I want to make sure we get, it looks like there's one remaining question that came in, so.
Yeah, it wasn't so much a question, but I suppose Kisha could comment on it. So we had an entity that remarked, the Lime Bike program in Ithaca, where you can rent a bike by the hour, resulted in a huge uptick in Black and brown riders. Many are not skilled riders, do not have helmets, and choose to ride on the sidewalks. But the demand and interest are definitely there, and a way to access a bike is engaging. Maybe combining access to bikes with resources of helmets and safe riding instructions through groups such as Kisha's could help engage vulnerable communities.
Mm-hmm. Yes, definitely. Some of the Black Girls Who Bike chapters do exactly that. They work with organizations to support safer riding and skill trainings, like, you know, how to design the signals of bike riding. I know my group we have not done anything like that because we have organizations here that supply helmets and bikes to children and adults. But where is it exactly? What state?
It's in
What city?
Ithaca, New York, so Finger
Oh,
Lakes.
Ithaca.
Yeah.
Okay. 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 Yeah. Yeah. Some type of collaboration would be necessary. Well, not necessary. Would be helpful to help provide helmets and instruction on bike safety. And that riding on the sidewalk that's old school. But because people don't feel safe,
Exactly.
they ride on the sidewalk. So
I guess I would like to follow up on that with, you know, you mentioned that you were an adult rider. And, you know, I don't know if you rode often as a child, but I guess I would like to pose the question to you because about maybe some of the struggles that you faced as an adult rider trying to pick up bicycling at an older age. If you feel like some of those programs like cycling education classes and helmet programs would have been beneficial to you, or if you would have been more interested in seeing, you mentioned that most of your early riding was on the trail. So if you'd be more interested in, I guess, what if it would have made the pathway to riding a bike again as an adult easier if there were infrastructure and things like that, as opposed to the educational programming.
Mm-hmm. So yeah, I did ride a bike as a child all the time. But you know, children, school, marriage, life got in the way. But once all my children left home, then I was able to kind of start doing things for myself. The canal riding was, for me, just a safe place to ride. The continuing of riding, the riding in groups, the instruction, all of that, I feel made me a stronger rider and a more confident rider. So it wasn't just one, you know, wasn't just the instruction, it wasn't just the canal riding, it was a combination of the canal riding, the riding in groups, and the instruction that made me a more confident and stronger rider.
Okay, so I believe this wraps up tonight's session. I don't believe there are any more questions. Are there, Paige?
Nope, we're good.
All right. I'd like to extend a huge thank you to Kyle, Andy, Kisha, and Benjamin for today's session, and to the attendees who have joined us. We hope you enjoyed it. Before we sign off, I'd like to put in a short plug for our upcoming webinar scheduled for next week. We have a user-centered zoning codes webinar on October 7th, and preparing for e-bikes and e-scooters, what planners need to know about regulations, infrastructure, and accessibility on October 8th. Be sure to register if you have not already. We hope you enjoy the rest of your evening. Thank you.
Thank you, everyone.
Thank you, everyone. Take care.